Part 2 of the Psychopharm questions. Don't skip the challenging ones because it's better to get them wrong now than on your actual exam. A patient taking a high-potency typical antipsychotic begins to experience milky discharge, galactorrhea, and amenorrhea. Blockade of dopamine in which of the following tracts is responsible for these symptoms? A. Nigrostriatal tract. B. Mesolimbic tract. C. Tuberoinfundibular tract. Or D. Mesocortical tract. The correct answer is C. Tuberoinfundibular tract. You have to know the dopamine pathways for both the PRITE and the boards. They love to test on these. So the tuberoinfundibular tract projects from the hypothalamus to the pituitary gland. You got to know where this comes from and where this goes to. The blockade of the D2 receptors in this pathway is what leads to increased prolactin levels, which causes galactorrhea and menstrual irregularities. A 48-year-old male with a history of diabetic neuropathy presents for major depressive disorder. Which medication is FDA-approved for neuropathic pain and lacks significant antihistamine effects? A. Mirtazapine. B. Duloxetine. C. Quetiapine. D. Amitriptyline. Or E. Paroxetine. The answer is B. Duloxetine. Duloxetine is actually approved for neuropathic pain and fibromyalgia, and it lacks significant antihistamine or anticholinergic effects. Amitriptyline, although we commonly use it for neuropathic pain, is not FDA approved for neuropathic pain. A 29-year-old man presents to the ER with lacrimentation, rhinorrhea, piloerection, and intense muscle aches. Which medication can help alleviate these symptoms via the alpha-2 adrenergic agonism? A. Naloxone. B. Buprenorphine. C. Clonidine. Or D. Methadone. The answer is C. Clonidine. This patient is going through opioid withdrawal, and clonidine helps alleviate the autonomic symptoms of opioid withdrawal through its action as an alpha-2 adrenergic agonist. You can remember this by clonidine calms cold turkey. A 30-year-old woman is brought into the ER after an intentional overdose on her lithium. Her serum lithium levels are 2.8, and she is exhibiting confusion, coarse tremors, and ataxia. What is the most appropriate treatment at this time? A. IV's normal saline. B. Gastric lavage. C. Hemodialysis. Or D. Activated charcoal. Dialysis is the treatment of choice for severe lithium toxicity. You also need to know that activated charcoal does not work, so never choose that answer. A patient stable on Clozapine is treated for heartburn with an over-the-counter medication and subsequently develops sedation and increased drooling, suggesting elevated Clozapine levels. Which medication was likely added? A. Tylenol. B. Cimetidine. C. Omeprazole. Or D. Calcium carbonate. The answer is B. Cimetidine. This is one of those medications, on the other hand, can actually decrease Clozapine levels. A memory trick for remembering Cimetidine is Cimetidine climbs Clozapine. A 28-year-old pregnant woman in her first trimester is admitted for a severe manic episode with psychotic features. She has a history of bipolar 1 disorder. Her symptoms are refractory to conservative management, and she is refusing most oral medications due to concerns about fetal safety. Which of the following is considered the safest and most effective choice for her current state? A. Lithium. B. Valproic acid. C. Oxycarbazamine. Or D. ECT. The correct answer is D. ECT. ECT is considered the safest choice for severe mania during pregnancy because there's no real contraindication to the procedure in a normal pregnancy. Remember that lithium is associated with Epstein's anomaly, that's always high yield. Valproic acid and oxycarb carry risk for neural tube defects, which is also high yield. A patient is started on Chantix for smoking cessation and asks you the mechanism by which the medication aids in smoking cessation. You tell them it's A. a nicotine antagonist, B. a full nicotine agonist, C. a partial nicotine agonist, or D. a dopamine reuptake inhibitor. The correct answer is C. Chantix is a partial nicotine agonist that decreases cravings and withdrawal while blocking reinforcing effects of nicotine. You gotta know the mechanism of action of medications because they love to ask on these. A 41-year-old patient is discontinued on her sertraline due to nausea and is switched to Mirtazapine. Mirtazapine is often used to decrease nausea in depressed patients. This effect is thought to be due to antagonism at which receptor? A, 5-HT2, B, 5-HT3, C, alpha 2, D, H1, or E, D2. The correct answer is B, 5-HT3. Mirtazapine's antagonism of the 5-HT3 receptor is thought to be responsible for the anti-nausea effects, and this is actually similar to the mechanism of Zofran. A 59-year-old patient with chronic liver failure and cirrhosis requires pharmacologic management for acute anxiety. Which of the following benzodiazepines would be the safest choice? A, diazepam, B, lorazepam, C, alprazolam, or D, triazolam? The correct answer is B, lorazepam. You gotta know which benzos are safe to use in severe hepatic disease. Most benzos like diazepam or alprazolam require hepatic oxidation, phase 1. Lorazepam, on the other hand, only requires phase 2, which remains relatively intact in liver disease. The memory trick you can use to remember this is L.O.T. So lorazepam, oxazepam, and temazepam are all safe to use in liver disease. A 68-year-old male with significant renal impairment requires medication for neuropathic pain. Which of the following is unique for being excreted unchanged in the urine, requiring significant dose adjustment in this patient? A, Tylenol, B, gabapentin, or C, buprenorphine? The correct answer is C, gabapentin. Gabapentin has no interaction with the CYP system and is not metabolized by the liver. The other options are primarily metabolized by the liver before excretion. The memory trick you can use for this is gabapentin goes straight through the kidneys because it is excreted unchanged. To challenge yourself with more questions, check out Part 1.